Okay, with that, I'm excited to turn things over to Natalie, Chuck, and Dr. Baldwin.
Thank you so much, Patrick. We're excited to be here. Thank you everyone for taking time to join today's webinar. We're fortunate to be joined by two amazing experts who I'll introduce you to in just a moment. But first, why is this topic important? We give Medicaid members an experience they've never had before: unlimited access to a doctor. A virtual care solution can help address fundamental challenges in Medicaid, access to care, and member engagement. Traditionally, Medicaid members aren't engaged in the healthcare system. Virtual care offers high-quality healthcare at the lowest cost access point. By removing barriers for members, virtual care can be a tool your members love from that first use, and as in MPC's case, a plan differentiator. As Patrick mentioned, I'm Natalie Pavella. I oversee CirrusMD's relationship with many of our Medicaid partners, including MPC. I'll let Chuck say a quick hello and introduce himself.
Hello, thank you very much, Natalie. I want to note appreciation to MHPA and CirrusMD for inviting me to come speak with you all today. This is a great opportunity. Chief Operating Officer with Maryland Physicians Care. We are a statewide Medicaid managed care plan based in Maryland. We've been participating in the Health Choice program for now it's 26 years. So it's been very interesting just seeing things change over time, and then also dealing with just the different demographics, rural, urban, suburban, and so forth. We have a little under 250,000 covered lives right now, and we are a provider-owned managed care plan. We've been working with CirrusMD for a little over 5 years now, and we're really excited to talk about the progress that we've been making together.
Thank you, Chuck. Now let's meet Dr. Baldwin.
Thanks, Natalie, and thanks MHPA for inviting me to speak. My name is Donna Baldwin. I'm a family medicine physician who's passionate about providing high quality, evidence-based, equitable primary care telehealth. And today I'm gonna be excited to share with you some practical examples of how we've made a difference in Medicaid lives at CirrusMD, where I serve as the Chief Quality and Innovation Officer, as well as a practicing primary care telehealth physician.
Thank you, Donna. Now let's get started with today's discussion. Here's a quick overview of what we'll be covering. First, we'll hear from Chuck with an actual case study of the MPC story. We'll hear how they threw out the old playbook to create a new engagement strategy, including the situation they were addressing, goals that were set, and the approach that was taken, and the outcomes. And then we'll pass things over to Dr. Baldwin to give us a clinician's perspective on delivering virtual care to Medicaid members, including the 4 tenets of virtual care, an example of a patient journey via virtual care, and how virtual care is evolving in scope to create a broader care model that helps more patients throughout their care journey. Then we'll dig into our panel discussion with our 2 experts, and we really want to hear your questions as well for both of our panelists. So please use the Q&A function to submit your questions throughout today's webinar. Now let's get started. Chuck, we're going to kick things off with you.
Thanks, Natalie. So to really look back at what Maryland Physicians Care was looking to accomplish, this is probably going 6 years ago. Overall, we were looking to lower our ED costs, and that's something that I know many managed care plans face every day. Additionally, we're trying to create some additional value for our members. Transportation remains an issue for our members today and for a number of consumers across Maryland. And so we really were trying to ascertain what more we could do from our end to try and help the brick and mortar approach that we had been providing. Additionally, we wanted to have a mechanism where we could track outcomes and understand what our members would have done as alternatives. So we wanted to have some ability to see, were we having success with the program itself? And probably more than anything, we felt to make sure that this would be adopted, that this would be easy to use. And we really wanted to put an emergency room physician in the palm of their hand. That was the goal when we really got through our final conversations with Cirrus. And what I'll just note here, which you can see clearly on the far left hand part of the slide, is that Cirrus provided us a white labeled solution. So it was important for us to remain Maryland Physicians Care. We got MyVirtualMPC by Maryland Physicians Care. And, we made a decision just couple years ago to say we're going to have one app. This is our app. We're not going to have multiple apps out there. And I think Cirrus has done a really nice job of providing us additional options as to what we could add on to the platform. The other thing that I want to note is really just the additional support. This is a supplement to our existing brick and mortar. We still want members to be going into their PCPs. This is, all right, if you're going to go to the emergency room, you're going to go to urgent care, but you don't need to. How can we solve that problem? I mentioned the goal of being easy to use. Right now, it's on average 16 seconds response to when an individual consumer of ours types in what their issue is. That's the average response rate that we're getting an emergency physician getting back to them. And so overall, this has been very, very good to the organization, and it's provided us something that we could roll out across the entire state, which we can't do with all of our solutions. Our next slide here, what I want to really focus on is the progress we've made with both our registrations and our encounters over the last few years. As you can see, when we first started the program in 2017, 2018, 2019, we had some growth. But we really weren't putting a lot behind it. We were advertising it, but we were not utilizing all the various mechanisms that we really had available to us. As we got into 2020, and we'll show some of this much more greater detail later in the presentation, we started to see a significant increase in both registrations and encounters, but specifically encounters right around the inception of COVID. And that's really what this story is seeing the power of the platform when people were just coming out to it for that alone, and then keeping them on the platform and seeing the performances that we have been seeing. For several months during the pandemic, we've been around 4% utilization. To give some perspective, average national utilization is about 1%. And so we've been really excited to see how the platform has been utilized, to see how individuals have been registering for the program, but then also coming back and using it. And we'll showcase some of that later. We'll also talk a little bit about, well, what are we doing? So once COVID started to dissipate, so to say, we're gotten to the new normal of the COVID environment, we started to see the registrations wane and the encounters. So what do we do from there? And that's really where I think our collaborative partnership with Cirrus really allowed us to take off. So next slide here, we have our overall approach. And what I would say here is we needed to have a multi-pronged approach. This was really the core behind this, from my perspective, was CirrusMD's marketing experts. So we employ a marketing firm. Maryland Physicians Care does. We employ an advertising firm, and they are great. They help us with numerous things. But CirrusMD's marketing experts were just very, very focused and specific to what their platform provided. And what we did was we took these messages and looked at, well, what would the right frequency be? What would we say to individuals that weren't in the program at all? What would we say to some of our members who had utilized the program, but maybe they haven't gone back to it in a year? And got very, very tailored in our approach. And we were very methodical about how do we ensure we don't inundate them. But looking across the platform of, all right, we have texts, we have emails. There's a lot of different ways that we can communicate with our membership, but everything came back. So it still had the MPC, the Maryland Physicians Care feel. It wasn't as if this was something that was separate. I think from a marketing perspective, that was really important to us. But if you take all of the communication alone, well, I think that was really great. And I think it helped us really push things out. It was a lot of additional effort. So, an idea of, hey, let's put together a campaign and try to say, if you register, you can possibly win XYZ fitness equipment, different things that we thought would be beneficial. And that really helped drive registrations. The other piece to this was we have a very large community engagement staff, and under operations, they're within my purview. So it's the agility of being able to utilize them. We have 10 community engagement staff across the state. And so when they're meeting our members out in the community, they're talking about the product, they're helping them enroll with it. So it's really been this collaborative effort that's allowed us to be successful. Overall, I talked a little bit about the emails and the text, but just to give some perspective around our numbers, to just look at your own plans, we have emails for about 23% of our members. It's about 55,000 members. We have phone numbers for 46% of our members. That's, I think, around 109,000. So, we deal with some of the same problems that you do, where we don't have valid phone numbers for everyone, but we take this information and we really protect it from our perspective. We don't want individuals opting out of programs. So as I said earlier, we don't really push things on our members. But you can see here's an example of the registration sweepstakes that CirrusMD helped with us promote and push out. And you can see just a very clear-cut, easy communication saying, here's how you register. And I think the message is, from our perspective, it was very much about the accessibility of the product. So you have the immediate text-based care that I talked about earlier, 16 seconds. There being an overall, cost benefit to even the member, right, of not having to go out and do some additional things that aren't covered under the program. The care navigation support, from my perspective, this provides, this kind of holistic care that they can be asking about, which is really helpful. And then if there's more chronic conditions, those can be routed accordingly. Dr. Baldwin will talk a little bit more about, from my perspective, just a case study and some other opportunities where this really makes sense for us. And we really just wanted a call to action and to make this as easy as possible for our members to utilize. And so I think when I look at things, it really became about how are we being successful? And I think with this collective strategy that I referenced to you, we have been very successful. So for example, we've had a 7x increase in our net new registrations. And, I talked a little about COVID, that definitely was a driver, but I think what we did after the fact and then maintaining has really allowed us to do some of the things we've been looking to do. With that, we're, at a 3x the national average, as I noted earlier. And we've sustained, 3% over the last 10 months, which is really, really great. We've doubled our monthly engagement goal. So, what we did in 2020, we said, okay, in 2021, we're going to do this. In 2022, we're going to do this. And I think, overall, we've seen that we are getting the outcomes that we're looking for from a registration perspective, from an encounter perspective, the new member behavior that we're seeing, people coming back and utilizing the program multiple times. That really tells me that this has been effective for us. And we're providing that additional level of accessibility that we were looking for earlier. The next slide here, this is what I was referencing earlier in the presentation, and really wanted to take you back to the beginning of 2020 and to say, when we saw the inception of COVID in that February, March timeframe, you can see in registrations, significant increase. Once again, same thing on the encounter side, you're seeing these parabolic rises. And they start to, drop off and wane over the course of 2020. But from my perspective, they're still maintained at a level. From an encounter base, we were still maintaining at a level that we hadn't seen previously. So what we show there for January and February of 2020, that's really what we were experiencing back in 2019 and prior to that. So our encounters are maintained throughout 2020. Yeah, the registrations are dropped off. So we really said, all right, well, what can we do about this? And that's when I would say is really that end of Q2, we really were working collectively together to say, what are we going to do? And so we implement this multi-pronged approach through the text campaigns, through the emails, revisiting our website, making it very clear this is a differentiator for us. So we put this in all of our marketing and advertising materials, and we're pushing it in the community. Now the community is opening up. In 2021, we're seeing a significant amount of more events in the state of Maryland. And you can see our numbers throughout 2021 into the summer and into the fall. They just skyrocket, way further than what we experienced when we first saw COVID. So we were extremely pleased with the outcomes. We were seeing encounters going up as well. We were seeing repeat visitors, but then the numbers started to drop down a little bit more. So we've continued to work collectively and look at other opportunities in regards to how do we build upon these numbers. And I think if you look at 2022 year to date, we've been able to sustain an upward trend from an encounters perspective. And we're pretty much at our goal, a monthly goal of what we want to be seeing right now. The registrations we're continuing to push. I think there's more to be done there. But at the end of the day, registrations equal utilization equals diverted ER visits, decreased cost of care. It's a win-win-win situation across the board. So here are some of the things that I was really excited to share with everyone today, because when I tell people about CirrusMD, these are the things. I mean, it's impacting our consumers. It's impacting our members. That's who we're trying to take care of. You can see here, 70.6% of our registered users are repeat users. We've got 17,000 members in total registered. That's 6% of our current eligible population that is registered today, which we're very pleased with. We were seeing a great ROI on the product from our perspective. So 5.5 is the average app uses per registered member. And that, when I first saw that number, I was really blown away. I thought, well, maybe someone's used it 2 times or 3 times. These are people seeing, well, I can use it. I've got a larger family. I can really, take care of some immediate needs. When our members are asked what they would have done as an alternative to utilizing this tool, 60% of them say, well, they would have gone to the emergency room or to urgent care. So, that to us is, a save on the member. They don't have to leave their house. They don't have to waste their time sitting around when they could be doing something else. But also it's a significant savings to our organization. Looking back at the member perspective, 88% are likely or very likely to recommend MPC. So we're very happy about that. We think that helps drive our overall enrollment numbers as well. And you can see just the overall satisfaction at 93%. It's hard to please people. It's hard to satisfy people. So to see this number, I feel we're being very successful. If you look at the next slide we have, I'll just share a couple of anecdotal references based off surveys. Doc was personable and friendly, felt like a real person. And he gave us all the ideas and info we needed. It gave us comfort. It was much easier than dragging all my kids to the doctor. This service allowed me to get assistance and guidance without having to find childcare, call out of work, or be around people that were sick. The doctor was prompt, asked meaningful questions, and great follow through. And this one really hits on it all, is people have multiple things that they're trying to juggle. This really helps them with that as they move forward.
Thank you so much, Chuck. That was super amazing to hear. I'm going to pass the baton to Dr. Baldwin next. Please remember you can submit questions to either Chuck or Dr. Baldwin using the question button you should see on your screen. So now we know that there's a lot of positive impact to be gained by reaching more members, and members have a more clear understanding of when and how to use their virtual care services. Let's talk more about the cycle you're creating of greater accessibility and equity. So to learn more about that, I'm going to shift our conversation over to Dr. Baldwin, who can tell us more about her experiences in delivering care more equitably for our Medicaid members throughout the U.S.
Thanks, Natalie, and thanks so much to Chuck for sharing his story of building a successful engagement program with the Medicaid audience. As we all know, can be challenging members to engage. As a family medicine physician, I've worked in both brick and mortar settings as well as virtual care settings, and I'm really proud of delivering telehealth purposefully, thoughtfully, and equitably, and really wanted to share some of my experiences and practical examples of how we're being able to participate in expanding the types of care that are provided via telemedicine and really getting some good health outcomes and providing a service that really matters to patients. So let's start with a typical patient I care for on CirrusMD. So Kyle's a 38-year-old male. He comes on the platform needing a refill of his albuterol. He does have a new PCP, but his appointment is quite a ways out, and he lives really hours outside of a major city. So transportation is really challenging for him to get in. So before we talk more about Kyle, providing a service and providing a healthcare service like telehealth to members is really only as beneficial as if it's used. And so when we look at equity, it's different from equality. Equality means that each individual is given the same resources, as you can see on the left. But equity recognizes that each person has different circumstances and really focuses on reaching an equal outcome. In other words, equity means that everyone can get what they need in their own way. And again, offering a benefit like telehealth is really only a benefit if it's used and the outcomes are making a difference. So as we look at making telehealth an ubiquitous solution across the US, we all have different needs based on the community we are serving. Where we all come together is when we look at providing telehealth equitably. So for telehealth care to be equitable and effective, I believe it must provide these 4 tenets. First, it needs to be immediate. We need to create an experience that's on the patient's terms and when the patient is in need of healthcare. It also needs to be easy and affordable. We selected text as a way to access a doctor because it's effortless and something most Americans use every day to consume so many different industries, so why not healthcare? We didn't know at the time how much it would level the playing field for everyone, but it doesn't require broadband, doesn't require a private location or scheduled time away from work, home, or school. And so what we've seen is more engagement with members, especially Medicaid members. I had one yesterday who said, thankfully I did not have to do a video because that would have sucked all of my data for the entire month because she didn't have access to Wi-Fi or broadband. All she had was her data plan. It also has to be integrated. The healthcare system is complex enough. So in order to create an equitable telehealth solution, being able to create an experience around the patient, to get connected to a doctor, to get connected to network resources, to be really a part of the existing healthcare ecosystem and not fragmented even further. And so really, regardless of what a patient has a question about, concern about, or condition about, providing a healthcare experience and a digital front door that really helps them get solutions for what they're needing. It also has to be personal. The use of bots and certain types of technology makes healthcare seem like it's a black and white algorithmic type of an experience, and it's really not. As a physician, I know that every individual is different, has unique needs. So trying to figure out the person by creating a human-to-human connection with a physician is really important to really address and solve those needs. So this is just one example of how CirrusMD looked at two patient populations. So we looked at Black Americans and we looked at white Americans. We wanted to know what type of care they were coming on for, what kind of care they received, and what they would have done if they didn't have this solution. So this slide's pretty boring, right? So what we see across the board is that Black Americans and white Americans were equally satisfied with their visit. We also saw that they came on for similar things. And in fact, how they got their condition resolved, meaning were we able to solve their problem on the service? Or did we have to refer them in to in-person care? You can see here, it also is very similar. Where we found differences is around what they would have done if they didn't have access. So the main differentiator is really on diversion outcomes. Prior to having access to CirrusMD, Black Americans were more likely to go to the ER for the same needs. Access to CirrusMD reduced the likelihood of them delaying care or going to more expensive site of care. As you can see here, Black Americans would have chosen to go be seen in the emergency room much more than the white Americans. I also would say that this does mimic some of the data that's out there in healthcare in general. And hopefully what we're doing on CirrusMD is building trust in Black Americans for using the healthcare system much more than currently exists. So let's get back to Kyle. So at the end of Kyle's first encounter, we learned that allergies are triggers for his asthma, and he's really overusing his albuterol 3 to 4 times a day. And that's significant because what happens is it becomes ineffective, meaning that when he really needs it, it's not going to work as well. He's not on a prevention inhaler, and he's had quite a few urgent care and ER visits in the last 12 months. In addition to that data, we use standardized scoring called an asthma control test, the ACT that you see on the right. And on his first visit, his score was pretty low. A score above 19 is actually considered controlled. So what we do is we talk about how to manage his allergies better. We talk to him about his albuterol use and when he should use it. We ask him if he smokes or if he has any other history of vaping or lung conditions. And then we talk about a prevention inhaler and the importance of being on that to help control his asthma. He agrees to doing so. We use his formulary and his in-network resources. We talk to him about scheduling with his in-person primary care physician. And if he does smoke, taking a look at his in-network resources to help with smoking cessation, as well as helping him on our platform as well. We do schedule a follow-up visit to follow up with him in a couple of weeks to see how he's doing. This is really important to check for adherence, to check for issues or concerns with his medications. And he does come back and talk with us, chat with us on the service. We repeat his ACT scores and check in with him, and he's doing really well. He has made an appointment with his PCP. It's still a couple more weeks out, but we're happy to hear that he's doing a whole lot better. And we're going to follow up with him again just to make sure he does get attributed and get that appointment. So by setting this up, we really wanted to study and see if these touch points and our specific interactions were actually helping. So we did an asthma study. We took these patients before and after, and you can see the clinical and statistical significance by having an easy place to receive healthcare that is accessible is really something that made a difference in Kyle's as well as all of our patients. So it's not just about asthma care. It's not just about meeting people for where their needs are, but really and truly, it's being available to patients of all ages, to be the digital front door to healthcare. For example, for women during all phases of their life, including maternal care, new moms, birth control options, menopause, telehealth can really be the first step to get care and get connected to in-network resources. And I'll hand it back to you.
Wonderful. Before we do kind of transition over, I know we do have one question that came in from Dawn, and this might be for Chuck. Curious about ED utilization data slide. Did you also compare diagnosis of patient being seen in the emergency department that may reflect higher utilization?
I'm sorry, can you say that one more time, Natalie?
Yeah, they were curious about when we were talking about that 60% of patients that mentioned they would have gone to the urgent care ER. They were asking if MPC compared that diagnosis of the patient being seen in the ED that may reflect higher utilization.
Okay, yeah. So I mean, we look very closely at the utilization that we have in regards to the individuals that are utilizing the service. So, you know, as Dr. Baldwin mentioned, you know, OB/GYN, that's our number one, pretty steady across the board. The services also utilized, and this is what we found, and what I'm saying here is whether they were going to go into the emergency or not, this is across the board, you know, everyone. We see a lot of ENT, sinusitis, and then I would say the third is more probably topical in nature, dermatology, burns, rashes, those types of things. And we've taken even our marketing and tried to build video around that so that we can show individuals how to use the tool, like how to download the tool, but then also hear the uses of why you would do it, why you would use this. And then put those in physicians' offices and some other places. So hopefully that answers your questions to the diagnoses overall.
Awesome. And I do have a couple questions queued up for Chuck and Dr. Baldwin, so I'll kind of transition to those, but please keep your Q&A coming and we'll get to those in just a few minutes. All right, so let's kick it off with Dr. Baldwin. From the example you gave about that patient with asthma, it sounds like virtual care has changed the way physicians are able to care for patients with chronic conditions. Can you talk about that and also how you tie virtual and care encounters back to the PCP?
Absolutely. I think that certainly the pandemic raised a level of awareness for patients and certainly health plans as well around how we can better utilize virtual care. Virtual care, as is in our example with asthma, is really creating an easy touch point for patients. The type of care that I'm providing on virtual care on CirrusMD far exceeds what I've been able to do in brick and mortar. That involves, looking at behavioral health outcomes, asthma outcomes, maternity care, and other types of chronic conditions. It's a comfortable environment for patients to come on, even in the middle of the night, and ask their questions. Oftentimes, as Chuck talked about, using the emergency room for things that maybe they didn't need the emergency room for, but they're frightened. It's a mom with a kid with a fever in the middle of the night. And being able to have a resource like this can really make dramatic improvements in ED utilization. Certainly, we like to make sure that patients are attributed to in-person PCPs. Virtual care should not be a replacement for either chronic conditions or PCP visits. And so working with our clients and working with our health plans to ensure that that information gets to the PCP and that the patient does follow up and is attributed. We use things like case managers. We can send information to the health plan so that they can have their schedulers outreach or case managers get them connected, and definitely working with them to make sure that the patient has all the resources that they can use.
Fantastic. And you kind of touched on my next question, which I'm going to ping over to Chuck and maybe can provide some more detail here. But really in the MPC scenario, how are you using virtual care to close these gaps?
Yeah, so I'll definitely add it to what Dr. Baldwin had stated, looking at a referral line over to MPC's case management department, and then the appropriate, and it's looking at kind of poorly managed chronic conditions, and then those individuals within our team being able to follow up by phone to those to our members in those situations. I think that that's been really helpful. What I would also say, looking at it from, care gaps from, a HEDIS perspective, this does not close that gap, right? So to Dr. Baldwin's point, we are, every time the physician's wrapping up theirs, referencing, do you have a PCP? When was the last time you saw your PCP? Those things are being asked because, conditionally they're being tried to push them back in that direction and make sure that they understand this is not your annual physical. This is a point in time moment of us providing you with, some support via telehealth. So I think from that perspective, we're really able to help these members.
Fantastic. And any additional thoughts on Dr. Baldwin?
Yeah, and Don had another question in the chat, so thanks for your engagement, Don. But definitely screening for SDOH concerns is a big part of what we do, not just for our Medicaid patients, but for all patients. It's truly our mission to provide easy access, barrier-free to those that feel underserved. And who doesn't in the United States feel underserved, whether you have a high deductible plan or whether you spend your entire day on Zoom meetings, you really don't have access to great care. And so making sure that that we're addressing the SDOH needs is critical. Do they have a car to get to the pharmacy? Do they have a means of being able to purchase their medication, and really digging into why they think they need to go to the ER, or why talking to them about their chronic pain and the issues that they're having, and getting them connected, as Chuck said, to their case manager to really highlight and elevate those concerns and needs. Because if I don't know about it, it doesn't matter what prescriptions I write, it doesn't matter what recommendations I make. If I don't check for adherence, if I don't find out those SDOH concerns, I'm being completely ineffective. So yes, the answer is yes.
Yeah, and I know, on top of that, isolation, loneliness, these things come up often, and we then look at those from the Maryland Physicians Care side to say, okay, well, what more can we do, from our SDOH platform as we're continuing to grow things out and account for these various things? What more can we do? It's more information being at our fingertips than what we had before.
Absolutely. Back to you, Chuck. Thinking about how you keep your members engaged in using the platform, do you feel like utilization will fall off again, or are there certain kind of tactics you have in store to increase engagement?
Yeah, thank you for asking the question. So I think this is one of those things where it's a shotgun approach, and then you look at things and you try to figure out how you can then get a rifle out and be very precise in certain situations as to what works better. One of the things that I'll note that we did as an organization was we created a member rewards program called Belong. And part of that program, it's a rewards, incentive-based program that, we're looking for them to provide us a phone number, provide us an email. We're getting most current contact information, but they get additional points, which they can utilize for various things. They get additional points if they sign up for MyVirtualMPC. So we're trying to really think holistically across what we're doing with some of our other programs to be bringing all of our efforts together and be supporting each other. The other thing I'll note is that, outside of the member rewards program helping grow this out, we also have made this a goal across the organization that everyone knows and understands. This was our goal for 2021. This is our goal for 2022. CirrusMD provides us very thorough reporting back to us, which we then push down to our staff. And I think that that's been really helpful because everyone knows exactly how we're doing. And there's a more collective approach of, well, can I really impact this from my department? And most people can make an impact on this at the end of the day. So I think by us strengthening our goals, that's going to help us. We're also really pushing out to just various opportunities, working with pharmacists, trying to get materials in their offices, larger advertisements, physical advertisements that speak to the program, utilizing QR codes, trying to really drive to see the outcomes, what's being successful, what's working. We feel that, in that situation, maybe that's something where a consumer looks at it and goes, hey, in the future, in some situation, I might be able to get a medication via MyVirtualMPC, and all that's monitored to make sure it's not abused. But these are the things that we're doing. And then it's, 2023 will be here shortly, and we'll be coming up with more strategies to help grow this out.
Love that. And actually, go ahead, Donna.
No, I was just going to add to that. I also think, and this was a question in the chat too, I also think you can target at certain populations, right? And so we have programs where we're targeting maternity care. So really making an impact on getting pregnant moms in for their prenatal visits and coming alongside them. Well, child visits is another area that we can certainly support, as well as other HEDIS gaps, whether it's just high ED utilizers that we can target to really make a difference and then measure it. That's really important. And all the programs that we set up with HEDIS in mind, because we want to be able to give back that data to our health plans so that they can actually close some of those HEDIS gaps. So I think Don asked about Z codes. So for example, when we have behavioral health visits, we do use exercise counseling because that gets you closer to closing that HEDIS gap for depression. We do those follow-ups, and so documented visits. Again, with designing those programs that we assist to be able to keep HEDIS in mind, so that we can then feed that data back to you as a health plan.
Awesome. Thanks for addressing that question. Yeah, on kind of targeted outreach, Dr. Baldwin. Chuck, anything that you would add for MPC on certain populations that you're really targeting with outreach for your communications?
Yeah, I would say, as I noted earlier, we started this as trying to focus on ED diversion. And so we were really looking at individuals that had the highest utilization rates, just going into the emergency room. But over time, we expanded this out, and we believe there's value in this program for all of our members. And I'm really happy that it's available to our entire membership. When something like COVID happened, we had this ready. We weren't going to companies trying to figure out what we were going to do. This was already in place with a good percentage of our membership base.
Fantastic. Thank you. Dr. Baldwin, from a clinical perspective, what do you feel like is different when you're caring for Medicaid patients on the platform?
Well, they're often a lot more complicated just by nature, and whether that's because of the SDOH issues they present with or really the chronic diseases. So regardless of the diagnosis, we use a team-based approach. The asthma example, the patient comes on and they get, followed up with in our primary care clinic, where we have dedicated physicians that are specialists in asthma care to follow up with them to ensure that continued level of engagement, that continued adherence, and then working with our Medicaid partners, again, getting them connected to an in-person behavioral health specialist that's going to help them with their complex psychiatric issues, or ensuring that they are getting connected with their pulmonologist if they have complicated asthma issues. And as we've talked obviously before, making sure that they have an assigned primary care physician that's engaged in their health, and identifying barriers for those Medicaid members that aren't able to meet or are not meeting that. So CirrusMD has 4 million Medicaid members nationwide. And so we are developing best practices in different states and that have different resources for our patients. And we have client playbooks that are individualized for all those different programs with those resources so that we can get our Medicaid members the type of care that they need.
Fantastic. And one last question for Chuck. Do you get reimbursed for virtual care encounters, or how do you get, this to count as an encounter on the MPC side?
Yeah, no, thank you for the question. So we do not currently get paid for this. We cannot get this registered as an encounter. In the state of Maryland, they look at virtual care as really video based. So there's a piece of this that, more than a piece, we have to look at this as a value added benefit that we provide our membership. And we looked at that early on, and we knew that we'd have some struggles. We'd keep pushing to try and get this as a registered encounter. But at the end of the day, this is worth, from our perspective, it is a return on our investment. We are providing more value to our members. We're helping them have a better perspective of their overall care, making it easier on them during just hard times for everyone right now. And so, it's something that we've made note of, and we just say, okay, this is going to be an expense that we provide similar to other value-added benefits that we give our membership.
Fantastic. All right, I'm going to open the floor to any more audience questions that we may have had. Thank you to those who have already engaged with us in the Q&A chat thread. Let's see. Thank you, Dawn, for your engagement. I know there's one question I have kind of just while we wait for that, with Chuck, are there any, with this as a market differentiator, I guess the feedback that you've gotten from your members, or, 5+ years in, have you seen, competition within the state really start to develop these types of solutions, or do you feel like this still allows you to stand out as a differentiator in the Maryland Medicaid space?
Yeah, I think it's a great question. I feel I've had exposure to Medicaid in many states. I've never seen 9 private managed care plans participating in a program. It's a non-bid state. And so with 9 health plans, we have to be very, very thoughtful in regards to how we present ourselves to our members. And so we do look at this as a differentiator. I think that, being a local, health plan that's owned by local provider health systems allows us to be more agile and implement some things and move some things along. And I think to, others out there, to the ability to try and just, work together and get everyone on the same page, it's really, really helpful. that's allowed us to really implement the program and be successful. We have seen and we've heard people trying to kind of push some things out. We'll see what ends up happening with that. I think, overall from a competitive perspective, I look at it as something that, we are offering that no one else is providing right now. So it's at least something today. Maybe it's not sustainable, but even at that point, if everyone else does it, that's better for Marylanders overall. Now I've got to find another differentiator, another reason to say, come work with us. The other thing I'll note that I think is important is when you work with downstream vendors, they're an extension of you, whether you like it or not. And you want them to be that appendage to your body. And you want them to kind of have those similar interests and levels of concern that you have as a local health plan. And from my perspective, Cirrus has provided that in all of our interactions whenever we've wanted to try to do something new, or them bringing new things and options to the table for our considerations. We feel very comfortable working with them, that we're going in the same direction. And we don't feel that way with everyone that we necessarily work with, but it's really helpful from a telehealth perspective to have that type of partnership.
Well, I can say from my side, working with you and your team in the day-to-day, just having partners like MPC that are very collaborative, help achieve this success. So thank you.
Thank you.
We did get another question in the chat thread. This one's from Shailene, and I might punt this to Chuck. She's asking, what are the highest priority Medicaid populations to engage? Pregnant women, COPD patients. What does good engagement mean? And what are the metrics that matter?
Yeah, so those are great questions. From our perspective, if I look at pregnant women versus COPD, I think we've probably had more success with pregnant women overall. We can handle COPD. It's really in regards to when we're pushing something out and the message of how to not dilute the message, right? Like, we can utilize this tool for many different things. We have many more pregnant women in the Health Choice program than I would say we do with the COPD patients. And I work really closely with our chief medical officer so that, he can provide some influence from the clinical perspective, work closely with Dr. Baldwin and others. What I would say to answer the remaining questions that you had, good engagement from my perspective is you're utilizing the tool and you're coming back, but we're having positive engagements on you coming back. And ultimately that we're seeing members adhere to, as I was talking about earlier, that we still want you to go into your annual appointment. We would like you to get in and make sure you're getting your breast cancer screening. Those types of things, we're still pushing those. And so we're still working through analysis on that front, but I would say that is the ultimate piece that we're really trying to nail down, that would really showcase these individuals. Yes, they're utilizing the tool, but they're also getting back and getting the services that we want to. They're getting back into the brick and mortars and doing what they want, what we would like them to be doing for their overall best healthcare.
Fantastic.
I would just add, Shailene, I think that it can vary based on the Medicaid population that you're working with, and I think that we can provide expertise around who we think engages the most on the platform, and we can also help with really what the ROI is that you're trying to achieve. I think MPC is willing to pay for this without submitting claims because of the metrics that they're getting. They're getting the levels of engagement, they're getting the reduced ER visits. And so overall, that ROI is worth it. And so I think it really depends on what problems you're trying to solve with your members. And I think that can be different amongst our Medicaid partners, even under the same health plan, but a different state. So I think it's something that it's not one size fits all. And I think CirrusMD is built to be flexible and to partner with our clients to address the needs that you're trying to solve for your population.
And Dr. Baldwin, I'd add one more piece that we had provided 2 quotes of members that had provided some feedback in surveys. Honestly, we didn't have to dig to find those. We could have pulled from hundreds. And what amazes me about the surveys when we get them back is how much positive responses we receive. Typically in surveys, you have people coming back and responding because they were unhappy about the service that they received and what the experience was. And so across the board, we're really getting strong positive feedback. And that to me is saying, hey, the service is working for the consumer at the end of the day, which is a thing that we're considering.
Fantastic. It looks like we have one more question in the chat thread. Do you provide comprehensive medication therapy management as part of your strategy to help with some of your high-risk members?
So I'm not sure if that's geared towards a very specific medication therapy management, but what I will tell you is that we do take comprehensive whole person care, meaning that when a member comes on, we want to know their medical history, we want to know their medications that they take, the doses that they take, and certainly any allergies, and those are recorded, and we definitely will engage with them around how they're taking their medication, help with refills as appropriate, order labs as appropriate. So, certainly those high-risk members can be on multiple medications. And so really assessing that. More importantly, is really that level of engagement that they have with an in-person PCP. Again, it's not our intention to replace the PCP, nor, get in the middle of that care. And so, sometimes it's reassurance that it's okay to wait, or let's refill this right now, and then let's wait. Or, maybe even teeing them up to say, gosh, that's a great question for your PCP. I really think you should ask that. So I wouldn't say we have a specific program, but certainly that whole person care idea to address their immediate concerns, but also, understanding, how they're taking their medication and reconciling what we can, I think is part of how we want to care for members.
Yeah, what I can say to supplement what Dr. Baldwin had provided is that we get a significant amount of information back that our medical directors are able to review and just see everything that's being prescribed, all those things. But collectively, the other piece that I'll pull into this is, and I'd have to look at the actual number. I don't have to have it off the top of my head, but when I say it's 16 seconds on average to answer, sometimes people get the thought of, well, maybe it's only a 2-minute discussion, but that discussion can lead to a phone call. It can lead to more, and that can be of a pretty large length. I mean, we've seen 20 minutes. So it can be very comprehensive from that perspective, which I think has been very good in that, we feel like boxes are getting crossed off when our members are talking to the CirrusMD physicians. Once again, it's a supplement, but they're hitting on a number of things that are messages we want to be delivering. And that's part of the playbook.
And Chuck, right now it's sitting at about 25 minutes on average across the entire book of business. Additionally, we do, like you said, the nature of how our providers practice, they're not paid per encounter. They're not paid by patient they see. They're paid hourly. So it doesn't matter how many patients I see in an hour, I'm going to get paid exactly the same. So really incenting our physicians to take that time that the member needs. And sometimes it is a video. And so we can spin up a video with the member to further address the concerns. But there's not that rushed feeling. And as a physician, I love that. I love to be able to spend the time that I need to ask all the questions to really take that comprehensive care of the patient.
And then one last question, kind of more for Chuck, if you can speak a little bit more to the demographics of your population. I know we've mentioned around 250,000 members, but it can obviously vary state to state. Any other kind of demographics that you've seen with MPC that might be relevant for our audience to know as they kind of think about your story?
I mentioned this earlier, and I think a lot of people deal with this in your states. It's the challenges we have in Baltimore City are very different from the challenges that we have in Western Maryland, which is Appalachia, which are very different than the challenges of our members on the Eastern Shore. And so, when we look at accessibility, we believe we have a very strong provider network. This has really helped us. And when we look at the utilization, we do see high utilization outside of our urban areas. So, I think it is definitely helping in the more rural areas where, while we're still trying to figure out how can we help and provide a better alternative from a transportation perspective, this can help in certain situations.
Fantastic. Well, I know we are coming up to the end of our hour, so I did want to just extend our gratitude to everybody who's joined us here today. And again, for MHPA for allowing CirrusMD and Maryland Physicians Care to join. I've got all of our contact information here. Feel free to reach out to any of us. And as Patrick mentioned at the beginning, CirrusMD will be sharing out the recording and the slides after this. I'll hand it back to Patrick.
And please seek me out. I'm planning to attend MHPA next month in Phoenix. So if anybody's attending, would love to meet you guys live.
Perfect. Thank you so much. And yes, what a great segue. By the way, if anyone is having trouble getting hotel rooms, we are going to have an overflow hotel that is a 4-minute walk from the conference. So we will have places, rooms for you. And we'll have that information to you very soon. But I want to thank Natalie, Chuck, and Donna so much. This was a great presentation. I think the quality of questions reflected how helpful it was. So I want to thank CirrusMD, of course, Chuck, for your time. This was extremely valuable. And yes, this will be on our YouTube channel. And if you guys need anything, let me know. Happy to send your information to the CirrusMD team, though, of course, you have that in front of you right now. So again, everyone, thank you so much. We'll see you next week for another webinar from MHPA, and have a great afternoon.
Thank you. Take care, everyone.